Today is Saturday, March 22nd. It's said to be the most contagious virus known on Earth, and right now, a measles outbreak is spreading in West Texas and beyond. So what do you need to do to stay protected, if anything? Today, we're diving into the real-world impacts and necessary next steps for the hot zone area and the rest of the country with two different guests. Later in this episode, you'll hear a frontline perspective about what it's like for a small healthcare system in rural Texas trying to navigate an outbreak of a disease they've only ever seen in textbooks. Dr. Melanie Richburg is on the ground in West Texas. But first, I'm talking with Dr. Caitlin Jetelina, an epidemiologist, data scientist, and founder of Your Local Epidemiologist newsletter. She shares the science and overall impact of measles in the short and long term, what makes this year unique, and what the average American needs to know. Welcome to the Newsworthy Special Edition Saturday, when we sit down with a different expert or celebrity every Saturday to talk about something in the news. Don't forget to tune in every Monday through Friday for our regular episodes, where we provide all the day's news in 10 minutes. I'm Erica Mandy. It's now time for today's Special Edition Saturday. Caitlin Jetelina, thank you for joining us here on the Newsworthy again.
Thank you for having me.
So first, just give us the latest when it comes to this measles outbreak we're dealing with right now. And what's the feeling among healthcare professionals as you're watching it spread?
Yeah, so there is a significant measles outbreak in West Texas. It started in a very tightly knit community that is under-vaccinated and has now spread to more than 300 cases. The majority of cases are unvaccinated school-age children, and it's also now spread beyond West Texas.
And remind people why it is so hard to control an outbreak like this once it begins and how contagious measles is.
Measles is the most contagious virus known on Earth. An average infected person will infect about 18 other unvaccinated people. And one of the reasons it's so contagious is it spreads in the air. So it'll sit up in the air for on average 2 hours. So that means if an infected kid comes to the emergency department, everyone after that for a couple hours was exposed to this virus. The other complication or challenge that measles gives is people are contagious before the symptoms even arise, like a rash.
And the spread of measles is obviously bad enough, but it could also lead to other diseases spreading more as well, right? Because of something called immune amnesia. Can you explain that?
I mean, this is why measles virus is pretty nasty, right? It can cause hearing loss, it can cause brain inflammation, it can cause death. But for those that survive an infection, it wipes the immune memory from your body. So what we see in studies is that after surviving measles, people will, for example, die 10 years later from the flu because they just don't have any immune memory anymore for the flu. And so, yeah, I mean, measles is just not something we want to play around with.
What are other symptoms of measles that people should be aware of to first identify it? And then also, you talked about some of them already, but some of the things that measles can cause.
Once you're exposed, it's largely asymptomatic until early symptoms appear. And that's about 1 to 2 weeks after exposure. And that may be a fever, runny nose, cough, sore throat. And after these early symptoms, a rash appears. About 3 to 5 days later, it's red, blotchy rash, starts on the face, spreads to the rest of the body. And then we start getting other symptoms like muscle aches, sensitivity to light, and severe disease like pneumonia.
And it can really range from mild to deadly.
I will say, the vast majority of people, it is mild. It is, quote unquote, just a rash, but it's like playing Russian roulette. And we've already had 2 very unfortunate deaths from this West Texas measles outbreak. And so it is a tragic reminder that measles is deadly. It is severe.
But it is mostly contagious to unvaccinated or undervaccinated. The vaccine works incredibly well. Can you explain just how well this vaccine works?
If you've been vaccinated with the MMR vaccine, or you were born before 1957, which means that you were exposed to the virus naturally, you're incredibly well protected, about 97% effectiveness against measles. And that hasn't started waning yet. That is as far as we can tell, lifetime protection.
And it's not just protection like you'll stay out of the hospital, it's you won't even get it in the first place.
That's right. So it not only prevents severe disease, which is the main purpose of vaccines, it stops even transmission.
For Americans outside of areas actually actively dealing with an outbreak right now, how much do they need to worry and what steps should they be taking?
There's very little reason to be worried if you're outside of a hot zone right now, especially if you're up to date on your vaccines. Measles is not endemic, so it's not just spreading everywhere like we see with flu or with COVID. I mean, my anxiety goes down knowing how well these vaccines work. Now, not everyone can get immunity. For example, those under 12 months old are not eligible for a vaccine, immunocompromised. And so when I tell, parents or people that are immunocompromised, really pay attention to the news because there are sporadic cases of measles really peppering across the United States right now. And it's important for them to remain vigilant.
For people who are in a hot zone or a place where the outbreak is active, whether it's the actual county or even just the state, are there recommendations specific for them that don't apply to other Americans?
Yeah, I think the most important is MMR vaccination for our little infants. The recommendation in general, so outside of a hot zone, is that kids get their first MMR vaccine at 12 months. However, if you are in the middle of an outbreak or near it, those kids can get the vaccine as young as 6 months. There's no additional risk to it. The only challenge is that because their little immune systems aren't developed enough, they'll have to get another vaccine at 12 months too. So they'll basically get a 3 vaccine series instead of a 2 vaccine series.
Let's talk about adults, whether you're in an outbreak area or not. What should they be thinking about in terms of, are they fully protected, even if they got what they, got the full vaccine series as a kid? I don't remember for myself, did that include 2 MMR or not? So how do we know? What should we be thinking about?
For adults in hot zones, know that if you had at least 1 MMR vaccine in any time of your lifetime or were born before 1957, you're incredibly well protected. You're at 35 times less likely to get the measles than someone with no immunity.
I've read some that if you're not sure if you got the second dose, you should consider going ahead and getting a booster. What do you think?
Usually my suggestion is, especially if you're in a hot zone, it doesn't hurt to get a booster. I would definitely talk to their physician.
What about anyone who plans to travel internationally?
The current recommendation right now is if you have had 1 vaccine, you just take the normal precautions internationally. You practice usual precautions. The CDC website, as well as the State Department, has a list of, I think, about 25 countries that really need increased precaution, especially if there's a kid under 12 months.
There's been a lot of talk about using vitamin A to either prevent or treat measles. Can you explain where that came from and what people should know about it?
Vitamin A is a WHO recommendation, and it's recommended because it seems to work as a measles treatment among people that have severe vitamin A deficiency. And we see that it decreases mortality in places like Africa, for example. Only about 0.3% of the US population has vitamin A deficiency. So the vast majority of us have enough vitamin A just through our normal meals that a supplementation wouldn't do anything.
Do you anticipate getting these outbreaks under control in the near future? What are you expecting or watching for next?
We either get it under control using our tried and true public health measures, or it burns out because it can't find any more susceptible individuals that aren't vaccinated in these pockets. What's interesting about this year is that not only is this outbreak is happening, but measles is coming in very hot. We've had more cases this year in 2025 than the annual cases last year or the annual cases in the past 12 to 15 years. And so what that means is we're getting more and more sparks of measles. And that's problematic because all it takes is a spark finding another unvaccinated pocket and spreading like wildfire.
Are we at risk of losing our elimination status for this disease in America?
We lose the elimination status if a single outbreak is continuing to spread for more than 12 months. So we're pretty far away from that right now. Again, a lot of it depends on if we can get it under control. And I think that's a big if right now.
Anything else you want to mention or just a final thought?
I think the bottom line in all of this is get vaccinated. And if you're up to date on your vaccines, you are incredibly safe and can worry about all the other things we have to worry about in this world. And it won't be measles.
Still ahead, we're going to West Texas in the middle of the measles outbreak to hear more about the challenges of responding to cases with limited resources, why vaccine hesitancy remains an issue, and how small-town healthcare providers are doing their best to protect their communities. Dr. Melanie Richburg is the CEO of Lynn County Health System in Texas and an active nurse practitioner in primary care. We'll talk to her next, but first, a quick break for our sponsors. This episode is sponsored by BetterHelp. I really do think therapy should be accessible, not just a luxury. But the reality is, traditional in-person therapy can cost a lot, $100 to $250 per session, which adds up fast. But with BetterHelp Online Therapy, you can save, on average, up to 50% per session. In fact, you pay just a flat fee for weekly sessions at a price that makes sense. And if it can help with things like anxiety or even everyday stress, isn't it worth it? I think so. BetterHelp ensures therapy is within reach. For me, my health, both mental and physical, is important enough that it's worth investing in. So just like I pay to go to workout classes weekly, I pay for therapy. And if you're looking for a convenient, affordable option that lets you fit therapy into a busy life, give BetterHelp a try. Your well-being is worth it. Visit betterhelp.com/newsworthy today to get 10% off your first month. That's BetterHelp, HELP.com/newsworthy. The Newsworthy is also brought to you by Honeylove. You know that feeling when you get home from a long day and immediately want to change into comfy clothes? With Honeylove, it doesn't have to be that way. Everything from their shapewear and bras to their leggings and tanks are designed to be comfortable and functional. Whether I'm in the Honeylove Legging 2.0, which I adore for its soft, breathable fabric, stylish look, and convenient pockets, and wear for working from home, working out, and running errands, or I'm heading to a special event when Honeylove is my go-to for shapewear, giving me support, confidence, and comfort all in one without ever rolling up or down. Or I need new everyday essentials that I'll actually be willing and wanting to wear. Honeylove has me covered and keeps me comfortable. So treat yourself to the most comfortable bras, leggings, shapewear, and more, and save 20% off site-wide at honeylove.com/newsworthy. Use our exclusive link to get 20% off, honeylove.com/newsworthy. After your purchase, they'll ask you where you heard about them, so please support our show and tell them we sent you. Treat yourself to Honeylove because you deserve it. Okay, now back to our conversation. Dr. Melanie Richburg, thank you for joining us here on The Newsworthy.
It's good to be here.
So first, can you just briefly describe what you're dealing with in your county and the surrounding area, and what's the feeling in the healthcare community right now?
So for most of us in the healthcare community, I'm probably one of the more tenured ones. I've been doing this for 30 plus years, and Erica, I've never seen a case of measles. I've only seen pictures in books. Most of us are trying our hardest to educate the community about the symptoms, about the presentation, about the transmissibility of this virus, and the vaccinations that are available and vaccination schedules.
Is there any kind of panic about it in the community?
Not here, not really. There was 10 times more stress with COVID than there has been with this. We've only had 3 confirmed cases here in Lynn County.
So you have had a positive case come to your clinic?
We have. In fact, when this first started and they called me from the hospital and said, "We think we have a patient with measles. What do we do?" And I said, "Okay, let's isolate. Let's treat like respiratory isolation, and let's call the Lubbock Health Department hotline." We didn't have the specimen collection swab that you needed for this particular virus. Again, never done it before. So they actually brought one down here, and they looked at the kiddo and said, "Yes, we're more than likely he has the measles," or she, I don't know what it was. We ended up transferring that infant to a children's hospital.
For those who aren't as familiar, what are some of those challenges you face as a rural healthcare facility compared to those in more populated areas?
For us here, the facility is 53 years old. And so that's a challenge. I mean, it's a challenge to be able to adapt. We don't have a reverse isolation. We don't have a negative pressure room. And so, it's difficult. The, surplus of resources we have, there's just not any. I mean, for most of it's month to month. One huge catastrophe will sink my ship. And so we try to be as frugal as we can with our resources while taking as great care as we can with the patients. And that's, with this infant that we ended up sending to Lubbock, it's not because, we don't have intelligent people here. We don't have the special equipment that you would need to take care of an infant.
And even with you there, is access for the families in the area to healthcare still less than in other areas?
Yes. We serve Lynn County, which is Tahoka, but we have a community, O'Donnell, and we also have a clinic over in Garza County. So right now we're the primary health care for 2 counties that are at minimum 45 minutes away from the next emergency room or next hospital. We are the beacon in the night for a lot of people with healthcare issues and we may not have the equipment or have the expertise that they need, but we can sure stabilize them and get them to appropriate level of care.
How does that feel for you to know that even kind of during this outbreak moment, you are helping to make a difference for your community?
Every day it makes me feel good when we can help our community. Yes, there is a moment of pride when, the community looks to you for their information on healthcare. The one thing COVID taught me was that when people want information and they want accurate information, and for my community healthcare, they wanted to hear from us. And so we were very successful during COVID having a Facebook Live every Thursday at 2:00. And so we went back to using some of the same tools we did before with social media and making phone calls and really being a resource to the schools and to the community centers that have, some youth or child activities going on. Most days I want to say that's what we're supposed to do. That's my job, is to take care of this community. We have an incredible team here. The lab take care of specimens and make sure that nobody is unnecessarily exposed, and the nurses are on the ball of getting them to the right places, and environmental services is up to date on the procedures that they need to be doing to clean and isolate the airborne illnesses. So yeah, I am a proud mama on moments like that.
What is the feeling among patients and families in the region? Reports have said a lot are under-vaccinated or unvaccinated. Even before this outbreak, has there been a lot of fear around vaccinations? And what's the feeling now during the outbreak?
I think that there has been more people that are not believing in vaccinations as much as they did prior to COVID. So I think that did muddy the water a little bit with some vaccinations. I know flu, this last year we did not give as many flu vaccines as we've given in the past. With the MMR, that's a childhood vaccination, and I won't say that COVID has created an increase in parents that are not wanting to have their typical childhood vaccinations. I think there's always been a certain portion of the community or of any community that choose not to vaccinate. In the rural communities, we really don't have a lot of individuals that choose not to vaccinate their children. Here in Lynn County, now I know some of the Mennonite community, which is where this particular outbreak for us here started, the younger generation of Mennonites, that there's a lot more of them that don't believe in the vaccinations. The other thing that we see more than not getting vaccinations is lack of attention to detail, that until their kid probably gets in school and that the school, is really strict on you can't come unless you have your vaccinations or you sign this form. Some of them, the one we did last Friday, the mother, he had his first vaccination, or she, but she just never got around to getting the second one.
What do you want families in your area and around the country to know right now, specific to the measles outbreak?
I want them to know that it is real and that they need to familiarize themselves with the symptoms to look for. The other thing is that these vaccinations have been around since the 60s. And so they're safe. I would want them to know, as far as here in our community, that we are ready. If we have other cases that present, we are ready to take care of them, keep others safe, so that we can avoid exposure, and want to be a resource for our schools, that if they have kiddos and parents that have questions, then we are going to be here to answer those questions and help take care of them.
Well, thank you so much to both of our guests today. Be sure to check out the newsletter, Your Local Epidemiologist, for accurate and easy-to-digest info on the changing public health landscape. Go to yourlocalepidemiologist.co. And you can learn more about the Lynn County healthcare system in Texas at lchdhealthcare.org. Thank you so much for joining us today and sharing this episode if you found it helpful. We'll, of course, keep you updated about the measles outbreak and all the other news to know each day with our 10-minute daily news roundups every Monday through Friday. We'll be back on Monday with the latest news to know. Until then, have a great rest of your weekend.